ma'am. Good evening. I'm Edmarilis. I'm a student nurse for today. Ma'am, can you say your first name and last name for me?
Eva Marie Cortez.
And your date of birth, ma'am?
September 16, 2001.
Ma'am, how would you want to be addressed?
Eva.
Ma'am Eva, the purpose of this assessment is to determine any abnormalities in order for us to take an action and stop further complication. Is that okay with you, ma'am?
Yes.
Okay, ma'am. Ma'am, can you tell me where are you right now?
I'm at the clinic.
Okay, ma'am. And what are you doing here today?
I'm doing an assessment.
Okay. And what is the name of your mother?
Rosael Cortez.
So the client answered all those correctly. She is oriented and alert, and she knew who she was, and she can able to tell me her name and date of birth and the current event. Ma'am, before I'm going to the health assessment, I'm going to wash my hand first to maintain the cleanliness and prevent the contamination. And ma'am, also I'm going to gather the equipment that we are going to. And now I'm going to provide the privacy for you, ma'am. I'm going to proceed with the head and face assessment, and I'm starting to inspect your hair. And I'm going to check your face shape. I'm going now to palpate your temporal artery. And now, ma'am, next I'm going to palpate your temporomandibular joint, and I'm going to ask you if you're going to open or close your mouth. Open, open, close. Findings of head and face assessment. The client's head is symmetric, round, erect, and in midline and is normocephalic or appropriately related to the body size. Also, there are no lesions visible. The client's head is hard and smooth without lesions, and the patient's head is elastic and not tender. And the temporomandibular joint has no swelling or tenderness, irritations with movement. Mouth opens and closes fully, and the lower jaw move laterally in 1 to 2 cm in each direction. Ma'am, now I'm going to proceed to assess your neck. And I'm going now to check your neck structure. Can you touch your chest using your chin? Okay, ma'am. And can you turn your head to the left and to the right and backward? And I'm going to palpate your cervical vertebrae and the range of the motion. And now I'm going to palpate your trachea. And now, ma'am, I'm going to auscultate your thyroid. Ma'am, can you sip and swallow the water? Okay, ma'am. And the assessment of the neck. The client's neck is symmetric with head centered and without bulging masses. And the client's cricoid cartilage moves upward symmetrically as she swallows. And the patient's cervical 7 is visible and palpable. And the client's neck movement is smooth and controlled with 45-degree flexion and 55-degree extension, 45-degree lateral abduction, and 70-degree rotation. And the finding is normal. And now, ma'am, I'm going to proceed to inspect your auricle, tragus, and lobule. Okay, ma'am, and I'm going to palpate your mastoid process. Okay, ma'am, now I'm going to perform the whisper test. Ma'am, can you close your eyes and repeat after me? Assess. Upon the assessment, the patient's ears are equal in size, and the auricle aligns with the corner of each eye, and the patient's earlobes are tightly attached to adjacent skin with no apparent lobe. Upon palpating the patient's auricle and mastoid process, there were no tenderness observed, and the patient was able to correctly repeat the 2-syllable word as whispered. Now, ma'am, I'm going to proceed with the mouth and throat assessment. I'm going to inspect your lips. Okay, ma'am. Ma'am, can you open your mouth? Now I'm going to proceed to check the strength of your tongue and the size of your tongue. Ma'am, can you open your mouth? And can you extend your tongue? Okay, ma'am. Now, ma'am, I'm going to inspect the tonsils. Ma'am, can you open your mouth? And the assessment of the mouth and throat, the findings of the patient is, upon inspecting, the lips are smooth and moist without swelling or lesions, and the patient has 29 pearly whitish teeth with smooth surface and edges, and the buccal mucosa appeared pink in color. Upon inspecting, the tongue is pink, moist, a moderate in size with papillae present, and the ventral surface of the patient's tongue is smooth, shiny, pink, with visible veins and no lesions or swelling present. The frenulum is in midline. Wharton's gut is visible with salivary flow or moistness on the area. There is no lesion, ulcers, or nodules on the sides of the tongue, and the patient's tongue offers strong resistance, and the hard palate is pale with transverse rugae, and the soft palate, it is smooth, movable, and spongy. There are no unusual or foul odor. The uvula hangs freely in the midline with no lesions or redness present. The findings is normal. I'm going to proceed to the nose and sinuses assessment. I'm going to palpate and inspect the external nose. ma'am. And I'm going to check the patency of airflow through the nostrils. Ma'am, can you cover the side of your nose? One side of your nose. Inhale. Exhale. Now, ma'am, I'm going to palpate the sinuses. I'm going to percuss. Okay, ma'am. Upon assessing the nose and sinuses of the patient, the findings are: upon assessing the nose and sinuses of the patient, the findings are the nose color the same as the color of the face. There is no bulging masses, but there is a slight redness and swelling. The patient has no tenderness palpated upon palpation, and the patient can breathe freely through the nares. The patient's nasal septum is intact and in midline. The patient mucosa is pink, clear, has a watery discharge and no lesions. The maxilla and frontal sinuses of the patient is not tender. The findings is normal.